Okay, let's unpack this. Picture this.
Mm.
You're digging around in that, forgotten corner of the garage, or maybe tidying at the garden shed, and your hand brushes something unseen. You freeze.
Yeah, that feeling.
Or maybe you're just watching your dog sniffing around those same dark, quiet places, and a shiver goes down your spine. Spiders.
And not just any spider.
Right, the one that triggers that real kind of primal fear, the black widow.
It's a potent image, isn't it? That fear is, well, it's very real, especially when we think about our pets. They just explore these hidden spots without a second thought.
Absolutely. And that's exactly what this deep dive is all about.
Yeah.
Black widow spider envenomation in pets. We've got a stack of clinical guys, expert sources on this really serious topic.
Yeah.
And our mission is to pull out the absolute essential knowledge you need.
Yeah.
What do the experts say about recognizing the spider, understanding the unique way its venom works?
Right, how it acts.
Spotting the warning signs in your pet, how a diagnosis is made, and most critically, what treatment is needed and what you can realistically expect for the outcome. We're diving in to help you be informed, prepared, just in case.
Because, look, while these bites aren't, happening every day, when they do happen, they need urgent attention. Being prepared mentally, it can make a significant difference.
Right. And diving into those sources, the very first thing they emphasize is being able to recognize the spider itself. We're focusing on the female black widow, the Latrodectus genus.
Yep.
So what's the absolute, non-negotiable feature you need to look for?
Okay, the classic identifier is that shiny black body, usually between 1.5 to 2.5 centimeters. But the key feature, the absolute giveaway, is that distinctive red or orange hourglass marking.
Hourglass.
But it's on the underside of her abdomen. That's crucial. If you can't see that, it's hard to be sure.
Right.
It's also worth noting younger females can be brownish with red or orange stripes. And the males, they're smaller, don't have that hourglass, and aren't really considered dangerous to pets. Size matters there.
So, shiny black. Check the size, and most importantly, look for that hourglass on the belly if you can.
Yeah.
And where are you most likely to actually run into one?
They really prefer undisturbed, dark places. Think sheds, wood piles, garages, crawl spaces. Anywhere quiet and out of the way, usually around human structures. They have a pretty wide range globally, common throughout temperate regions, definitely including places all across North America.
Exactly, the kinds of places a curious dog or, a cat might stick their nose. Are they aggressive? Will they just bite if they see a pet nearby?
Generally, no. They're actually quite reclusive. They typically only bite if they feel threatened or trapped, or maybe if they're defending their egg sacs.
Huh.
A pet bumping into their web in a corner, that's a pretty common scenario for a bite.
Okay, now let's get into the science of the bite itself.
Yeah.
The sources make this really important distinction about the venom. It's primarily neurotoxic.
Yes, neurotoxic.
What does that actually mean? And why is it so different from, say, other spider bites?
That's the crucial difference, really. When we think of other spider bites, often we picture, big, nasty, local wounds, swelling, tissue damage, maybe even necrosis.
Right, like a brown recluse or something.
Exactly. Black widow venom is kind of the opposite. It causes minimal, sometimes local tissue damage. Its main target is the nervous system.
The nerves.
Yeah. The active component is this potent protein toxin called α-latrotoxin.
Latrotoxin.
And it's unique in how strongly it affects vertebrates, like our pets, and us too.
So this α-latrotoxin, you said it's unique. What exactly does it do? How does this one toxin cause, that kind of chaos in the body?
It's fascinating and, frankly, terrifying at the same time. The alpha-latrotoxin latches onto nerve terminals, nerve endings, and it basically forces this massive, uncontrolled release of specific neurotransmitters, chemical messengers.
There's a flood of them.
A flood, exactly. The big players here are acetylcholine, which is key for muscle activation.
Right, muscles.
And norepinephrine, which plays a huge role in the autonomic nervous system. Things like heart rate, blood pressure, gut movement.
So instead of destroying the bite site, it's like it hits the panic button on the body's chemical messengers. It just makes everything fire uncontrollably.
That's a great way to put it. That sustained excessive signaling is what leads to the severe muscle pain and rigidity and, well, all the other systemic effects we see.
Wow.
Now, it's important to remember, as the sources point out, there's also the possibility of dry bites.
Right, I read that. Not every bite injects venom.
Correct. Estimates vary, but maybe somewhere between, say, 15% to even 50% of bites might be dry, meaning no significant venom dose is injected.
So the pet wouldn't get sick.
Exactly. They wouldn't develop the toxic signs. However, and this is critical, the guides stress that any suspected black widow bite has to be treated as a potential envenomation until you're sure otherwise.
Makes sense. Better safe than sorry.
Definitely. They recommend observing the animal really closely for at least 8 to 12 hours. If no signs develop by then, it was likely dry.
That's a long window. Okay, so you don't wait and hope.
Yeah.
If venom is injected, how does that uncontrolled neurotransmitter release?
Yeah.
How does that show up? What are the actual signs we see in our pets?
The signs usually start anywhere from 30 minutes up to maybe 8 hours after the bite. They often peak around the 24-hour mark.
Okay.
And a really important point the sources make is that the severity and how quickly the signs appear are generally worse in cats and small dogs.
Because of their size.
Exactly. It's simply because the dose of venom relative to their smaller body weight is much higher, hits them harder, faster.
Got it. Size really matters here. So let's break down those signs. You mentioned local signs are minimal, maybe easy to miss.
Yes, frustratingly so. Often you find minimal or no signs at the actual bite location. You might see mild pain, a little stinging, slight redness or swelling. Maybe. Or potentially tiny fang marks if you look really closely. But these are just not reliable indicators. What you absolutely won't see with a black widow bite, unlike, say, that brown recluse we mentioned, is significant local tissue damage, large areas of swelling, or, necrotic wounds.
Okay, so rule number 1 is don't wait to see a big, angry bite wound. The real danger is systemic. What are those main systemic signs, then, from that neurotransmitter storm?
This is where the primary presentation lies. Severe muscle pain and cramping are classic hallmarks. You'll likely see pets vocalizing, looking restless, maybe even writhing because they're so uncomfortable.
Oh, poor things.
Then there's significant muscle rigidity and spasms. The sources specifically describe the abdomen becoming board-like.
Board-like.
Yeah, very tense and hard, and this is a key diagnostic clue, typically without tenderness when you gently touch it.
Interesting. Not sore to the touch, just rigid.
Right. And this rigidity can also affect the back and limbs.
Wow, intense pain and muscles just locked up like that.
Yeah.
What else should pet owners be watching for?
You might see tremors or fine muscle twitching, fasciculations they call them. This can then progress to weakness, difficulty moving or walking, what vets call ataxia.
Ataxia.
A reluctance to stand or move. And in severe cases, this can worsen to partial or even full paralysis.
Paralysis.
Yes. The guides specifically note that cats, because they're so sensitive, can become quite profoundly weak and limp, described as adynamic and atonic, just floppy almost.
That sounds terrifying.
It is. You can also see gastrointestinal upset, vomiting occasionally, believe it or not. They might even vomit up the spider itself.
No way.
Diarrhea, excessive drooling, siolism, and a complete loss of appetite, anorexia.
And those effects on the involuntary systems you mentioned earlier, the autonomic signs.
Right. Those can show up as a rapid heart rate, tachycardia, elevated blood pressure, hypertension, and rapid breathing, tachypnea.
So everything's just revved up.
Revved up, or potentially crashing. In the most critical, life-threatening situations, this can escalate to respiratory muscle paralysis.
Meaning they can't breathe on their own.
Exactly, leading to respiratory arrest. Also, seizures, collapse, or even coma. And sadly, even after the worst is over, that lingering lethargy and depression can persist for days, sometimes weeks.
That sounds incredibly distressing, seeing a pet go through that. You highlighted cats being more susceptible. Can you elaborate a bit more on those species differences?
It's really important for owners to know this distinction. Cats are significantly more susceptible. They tend to show signs faster. Their signs are often more severe.
Okay.
Paralysis can set in earlier, and they have a historically higher fatality rate if they don't receive treatment. That's a key qualifier.
If untreated. What about dogs?
Dogs are generally more resistant, meaning the effects might be less severe or maybe slower to develop, but they can absolutely still be severely affected. Larger dogs potentially have a slight edge in resilience compared to smaller ones. Again, that size factor.
Makes sense.
Also, very young, very old animals, or those with underlying health issues like hypertension, they're considered at higher risk too.
So, okay, given this whole picture, the varied signs, the lack of a clear bite mark, the potential for rapid decline, especially in cats, how do vets actually figure out that this is specifically a black widow bite?
It's really a clinical diagnosis, meaning it relies heavily on piecing together the history you provide and the signs the vet observes. There isn't a routine lab test like a blood test that immediately confirms black widow venom present.
So history is key. What kind of history?
Key historical points include, well, a witness bite, obviously, or strong suspicion of exposure in a place where black widows are found.
Like those sheds or garages.
Exactly. Knowing you're in an endemic area for Latrodectus species, one source mentions parts of Southern California as an example. That's also a big clue. And critically,
Right, that classic pattern, systemic chaos, minimal local wound. What specific things is the vet looking for on a physical exam then?
they'll be assessing for that generalized muscle pain and rigidity, specifically feeling the abdomen for that tense but non-tender quality we talked about.
Headboard-like belly.
Yep, they'll evaluate vital signs, heart rate, breathing rate, blood pressure. And a thorough neurological exam is critical to check for tremors, ataxia, weakness, or any signs of paralysis.
Are there lab tests that can help maybe support the diagnosis or rule other things out?
Yes, though again, none are definitive for the bite itself. Blood work might show elevated creatine kinase levels, CK levels.
CK.
Creatine kinase. It's an enzyme that leaks out of muscles when they're spasming severely, so it's a good indicator of that muscle damage going on.
Okay.
You might also see something called a stress leukogram, which is just a pattern in the white blood cell count seen with stress and pain. In very severe cases, if there's significant muscle breakdown, you could get myoglobinuria.
Myoglobinuria.
Yeah, muscle protein showing up in the urine sometimes makes it look brownish. Imaging, like chest x-rays, might be used to check for aspiration pneumonia if the pet's been vomiting, or just to help rule out other causes of breathing problems.
And speaking of ruling things out, I imagine there's a list of other conditions with similar signs that vets have to consider, right?
Yeah.
What are some of those differentials?
Oh, absolutely. When a vet sees these kinds of signs, muscle rigidity, pain, paralysis, they're thinking about things like tick paralysis,
Yeah.
tetanus, which also causes severe muscle stiffness, certain types of poisoning like organophosphates or carbamates. Those can cause excessive neurotransmitter activity too, muscle twitching,
Okay.
maybe acute polyradiculoneuritis, that's a nerve disorder causing weakness or paralysis, or even severe hypocalcemia, critically low calcium, which can cause tremors or spasms.
Wow, lots of possibilities.
But the specific pattern of signs, particularly that lack of local swelling and that non-tender board-like abdomen, really helps narrow it down towards black widow envenomation.
Okay, so it's like solving a medical mystery using the history and the physical findings. Now for the critical part. Treatment. If someone suspects their pet has been bitten, what needs to happen? Like, immediately.
Immediate veterinary care. Non-negotiable. This is a true medical emergency.
Get to the vet. Got it.
Treatment is primarily focused on supporting the animal, managing those severe signs, but crucially, there is a specific antidote available.
Okay, let's start with the supportive care first. What does that involve?
Emergency stabilization is number one. ABCs, airway, breathing, circulation. Ensuring the pet can breathe properly is vital because of that risk of respiratory muscle paralysis we mentioned.
Right.
Oxygen supplementation is often needed. And the sources really emphasize that in severe cases, especially with cats, intubation and mechanical ventilation, basically a machine breathing for them can be absolutely life-saving.
Wow, that's intensive.
It can be. 4V fluids are given to help maintain hydration and blood pressure, though they have to be careful and monitor closely if the pet has that hypertension, the high blood pressure.
And the pain management. Those muscle spasms sound just excruciating.
Pain management is absolutely paramount, a huge priority. Opioid medications like hydromorphone or fentanyl are typically the drugs of choice to tackle that severe muscle pain and cramping.
Opioids, okay.
Interestingly, the sources also mention that benzodiazepines, drugs like diazepam or midazolam, can be really helpful, not just for muscle relaxation and tremors, but also for agitation. And one guy had actually suggested they can even be more effective than some traditional muscle relaxants, specifically for the pain component here.
That's really interesting. Benzos for the pain, too. What about other muscle relaxants? Are they still used?
Yes. Methocarbamol is a common muscle relaxant used specifically to target and reduce those severe muscle spasms and tremors caused by the venom. It helps with the rigidity.
Okay, so supportive care manages the symptoms, manages the pain. But you mentioned a specific antidote.
Yes, and this is often the real game changer, especially in more severe cases or with cats. There is an anti-venom, Latrodectus mactans. It's typically derived from horses, equine origin. Exactly. This is a specific antidote that works by binding to and neutralizing the circulating venom molecules in the bloodstream. Stops them from doing more damage.
And how quickly does this antivenom work? Does it make a fast difference?
At the sources report, it provides rapid resolution of the clinical signs. Often within just 30 to 60 minutes after it's given, you start seeing improvement.
30 minutes? Wow.
Yeah, it's pretty remarkable. It's highly recommended for moderate to severe envenomations, and it's considered absolutely critical for cats and small dogs. Giving it early can prevent the signs from getting worse and significantly shorten the recovery time.
That sounds incredibly important. Is it, readily available everywhere? At every vet clinic?
That's where it can sometimes be a challenge. It is an expensive product, and not every veterinary clinic may keep it in stock.
Oh, okay.
They might need to source it quickly from a larger human hospital or maybe a veterinary referral center. It's typically given as a slow infusion into a vein, usually over 30 to 60 minutes. And the pet needs to be monitored very closely during and after they get it.
Why the close monitoring? Are there risks with the antivenom itself?
Yes, because it's a foreign protein derived from horses, there's a risk of hypersensitivity or even anaphylactic reactions, like an allergic reaction.
Okay. How common is that?
The sources say serious reactions are actually uncommon with appropriate use, but vets still monitor closely for signs like vomiting, difficulty breathing, facial swelling, or even changes in the color of the inner hair flap looking for redness, hyperemia. They might even give medications beforehand, like antihistamines or maybe corticosteroids, just to minimize the chance of a reaction, especially if the pet has a history of allergies.
Proactive measures.
Exactly. And it's worth noting one source mentioned a newer, more purified version of the equine antivenom called Fab2 that's completed human trials. It may have a lower risk of allergic reactions, but it's not yet widely available for vet use, as far as I know.
Still, good to hear. Research is continuing to improve things. Now, are there any treatments that should definitely be avoided? Things that don't help?
Yes, the guides are pretty clear on this. Corticosteroids, like prednisone, generally not recommended. They don't neutralize the venom, and they could potentially interfere with recovery or maybe even increase the risk of secondary infections.
So, no steroids?
Generally, no. Also, those older methods of managing bites, like cutting into the bite site, trying to suction the venom out, or applying tourniquets, totally ineffective and potentially harmful for black widow bites, don't do that.
Right. Good to know. So the strategy is aggressive supportive care, crucial pain control, maybe muscle relaxants, and potentially life-saving antivenom.
Yeah.
With that kind of treatment, what's the likely outcome? What's the prognosis look like?
The prognosis is generally considered good to excellent.
Really? Even with how bad it sounds?
Yes. Provided the animal receives prompt and aggressive veterinary care, especially when antivenom is administered early, that's a really hopeful message despite how severe the signs can be.
That is hopeful. What about cats specifically? You mentioned their prognosis was historically guarded. Has that changed?
That's right. Historically, yeah, the prognosis for cats was quite guarded to poor, just because they are so sensitive and things can go downhill so fast. However, the sources clearly state that with the availability and rapid use of antivenom, plus that aggressive supportive care, survival rates for cats are significantly improving. But they make the stark point that black widow bites are usually fatal in cats without antivenom.
Wow. Usually fatal without it.
That really underscores how vital that specific treatment is for our feline friends. It can literally be the difference between life and death for them.
That is such a critical distinction. What other factors influence whether a pet recovers well?
Well, the amount of venom injected obviously plays a role. We don't usually know that, but it matters. The size of the patient smaller is riskier, as we discussed.
Right.
How quickly the pet gets to a vet and starts treatment. Huge factor. Access to antivenom, obviously. And whether severe complications occur, like respiratory failure or seizures. Most animals who receive antivenom show significant improvement within just a few hours. But complete recovery, that can still take days, sometimes weeks. Things like lingering weakness, maybe lethargy, even difficulty sleeping might persist for a few months in some cases.
So it's a significant ordeal even with the best care, but with a much better chance of a positive outcome now, especially with the antivenom. What does the monitoring and follow-up look like after the initial crisis?
Patients usually require hospitalization for at least 24 to 72 hours, sometimes longer, just depending on how severe they were and how quickly they respond to treatment.
Okay, a few days in the hospital.
Yeah, they need continuous monitoring of their vital signs, their neurological status, pain levels, and definitely their breathing. Blood work might be rechecked to see how things are trending.
And then when they go home.
When they go home, owners need to keep a really close eye out for any residual weakness, lethargy, or signs may be reappearing. Providing a quiet, comfortable environment for recovery is important. One source even noted, interestingly, weekly wound site monitoring despite the minimal local signs, just as a general precaution.
Okay, let's try to distill this down for our listener, the pet owner listening right now.
Yeah.
What are the absolute need-to-know takeaways from this deep dive?
Okay, first, understand that a suspected black widow spider bite is an absolute emergency. Requires immediate veterinary attention. Don't delay, don't wait and see.
Get to the vet ASAP, number one.
Number one. Second, be aware of that potential delayed onset of the severe systemic signs. Your pet might seem okay right after the bite, but the serious stuff can take up to 8 hours to really develop.
And crucially, don't be misled by the lack of a nasty local wound.
Precisely. The minimal or absent local signs do not rule out a dangerous envenomation. That's huge. Also, understand the critical role, the benefits, the potential risks, and frankly, the cost of anti-venom.
Yeah, that's a big one.
It is. This is the specific treatment that can make the biggest difference in outcome, especially for cats and smaller dogs. Be prepared for the possibility and the cost of intensive care. This can mean significant hospitalization time, maybe even needing that mechanical ventilation in severe cases.
But importantly, it's not necessarily a death sentence.
Absolutely not. With aggressive therapy, the prognosis is generally realistic but hopeful. It can be costly, it can be emotionally challenging, but recovery is very possible now.
Good to hear.
And finally, being proactive with prevention is always the best approach, right? Reduce those hiding places around your home. Clear debris, seal cracks, use screens, particularly if you live in an area known for black widows, like those endemic regions one source highlighted. Learning to identify the spider is also a really useful skill.
This has been incredibly illuminating, really detailed the potential danger, but also armed us, and hopefully you're listening, with the knowledge that prompt action and specific treatments can just drastically change the outcome.
It truly shows the power of understanding both the threat itself and the medical tools we have available to counter it. It's pretty amazing, actually.
So as we wrap up this deep dive, here's something maybe to ponder. Given how discreet and reclusive these spiders are, often found lurking in those quiet, hidden places.
Yeah.
And the dramatic, widespread systemic effects their venom can have despite such minimal local signs.
Yeah.
What does this deep dive into the black widow bite tell us about the need for vigilance and awareness? Not just for the obvious dangers our pets face, but maybe also the potent unseen threats that might be closer than we think.